Well, that was a great way to start our day. We're now going to have some discussants. We will have 4 folks, and I'm actually going to introduce them all at once. First, so that you can forget who they are and they can reintroduce themselves, but also because I'm not the most graceful person, and having me walk back and forth across that stage is a recipe for disaster. So first, we're going to hear from Laurie Brotman, who is from the Bezos Family Foundation. She is the Bezos Family Foundation Professor of Early Childhood Development, Department of Population Health at NYU, and she has some great information to share with us. We'll then hear from Alison Gertel-Rosenberg, Director, National Prevention and Practice from Nemours, who we heard a little bit from the organization this morning. And then finally, we will have a dual presentation from Jody Whiteman, Director of Professional Development at 0 to 3, and her colleague Sarah Lemoyne, Director of Early Childhood Workforce Innovations at 0 to 3. So first, Laurie Brotman. Laurie, here you go. Remember, Alina is down here, and she's going to give you time. That would be my guess, yes.
All right. Good morning. I'm going to, hopefully it won't be too awkward for me to be looking at my slides, and I don't actually think I need my reading glasses because those are very large slides. So I'm going to just start with my title, which is Family-Centered Early Childhood Education as a Lever to Improve Both Population Health and Promote Health Equity. Just a little bit of background about our work. We've known for a very long time that poverty, adverse childhood experiences, or ACEs, and also racism affect all aspects of child development. And so you see all those different aspects in that circle. We think that this comes together, and the reason that poverty and adversity influence all these outcomes of child development, there are many different mechanisms, but one key mechanism is through the development of self-regulation. And by self-regulation, we're focusing on the preschool period when those skills really come together, and we're thinking about a child's ability to pay attention, to control impulses, to delay gratification, and to regulate their emotions. And fortunately, we've known for a number of years that these skills, not only do they develop in early childhood, but they are malleable early on, certainly through the preschool period. So 2 decades ago, we set out with that evidence to promote population health and reduce socioeconomic disparities through a family-centered intervention that would be broadly available, engaging, and effective for low-income, culturally diverse families. And these 5 principles really helped us to create the program and define the program, and each one is based on decades of research in other fields, in other areas, and also in really rooted in studies in psychology, in clinical psychology, developmental psychology, that have to do with parents and parent training, what used to be called parent management training for children. So we set out to develop something that would be a universal enhancement to pre-K, and that was to maximize reach and also acceptability. So this was part of the fabric. It was designed to be part of the fabric of an early childhood program. It was embedded in schools and facilitated by school staff, and the idea was to foster cost efficiencies in terms of building on existing people in their day-to-day jobs, and also thinking about sustainability of the program. It's timed with the transition to school, which is really important for children in that that's the time when self-regulation is really developing and solidifying, but it's also a really important time for parents when they're open to change and motivated to be involved in supporting their children's learning. We knew it would have to have multiple components to support both home and classroom environments, and also to engage families. And then at the core of ParentCore is a group-based parenting program that places culture at the center. And the idea was, in addition to helping parents to develop skills that we know are important for parenting, the idea was to build social capital and to create a parent core or a network of empowered parents. So another way of thinking about this program is that it's an enhancement to pre-K programs that supports leaders, teachers, and parents to create what we call safe, nurturing, and predictable environments for children. Parent Core has 3 components, and this is sort of a very simplified model to say that we're influencing the school or the setting environment through professional learning for leaders, pre-K teachers, mental health professionals in the school, and family support staff. We're influencing the homes through this parenting program, and we're influencing classrooms through a program for pre-K students that we call Friends School. Just so you can see, and you can find this information on our website, these are topics of the 14 sessions of the parenting program. These are some beautiful materials that families get, including a guide for parents, which is, has lots of photographs and tells stories of parents going through this program. These are the 14 lessons of the Friends School curriculum. And you can see lessons include things like paying attention and following directions, which is not up there, saying sorry and excuse me, identifying feelings of happy and sad and mad and scared, and also I am special and celebrating our differences. And on the right, you can see the different activities that take place during that 2-hour session, including free play, the lesson that you've just seen, a welcome circle activity, physical exercise, a food review, calm down, and this is done during mealtime when teachers are eating meals with the pre-K students. So we have a simple theory of change here that is about these 3 components coming together: professional learning, the parenting program, and the pre-K program, to create safe, nurturing, and predictable environments at school, in the classroom, and at home, and also to create effective family engagement outreach and strong parent-teacher relationships. And those come together with the social and emotional skill building from the Friends School curriculum to lead to child outcomes in terms of self-regulation, academic achievement, mental health, both in terms of emotional and behavioral health, and physical health. And I put this up there as our theory of change with these specific outcomes. One, because they are certainly driven by this understanding that self-regulation is related to all these different outcomes, but also because we have 2 decades of evidence from 2 large randomized controlled trials in New York City in high-poverty schools with pre-K programs that show that this program in pre-K can lead to short and long-term changes for children and families. So we have replicated evidence that the program leads to positive parenting practices in terms of safe, nurturing, and predictable environments at home, and also parent involvement in learning, both at home and in the classroom. Positive classroom environments that are safe, nurturing, and predictable based on observations with the class, and also strong family engagement strategies. And importantly, the program leads to increased school readiness, both in terms of self-regulation and pre-academic skills in terms of literacy and math. And then from pre-K through 2nd grade so far, we've seen sustained impact on academic achievement, both through test scores, primarily in reading, and also teacher ratings of children's academic progress. We've seen teacher ratings of mental health outcomes, both in terms of behavioral health and emotional health. And then, interestingly, and this is a replicated outcome for us, for children who start pre-K with low levels of self-regulation, we have impact on obesity, BMI over the 95th percentile, as well as health behaviors, including sedentary behavior and physical activity. And so, so that's great, and we've shown that there's the possibility of delivering a program in pre-K with the foundation, adding to the foundation of pre-K programs that will, has the potential to lead to these pretty incredible outcomes on health, mental health, and academic achievement. But to go from those findings to actually spreading and taking the program to scale is really a whole other thing. And so A couple years ago, we made this plan to focus in New York City and to scale Parent Corps throughout New York City through all 5 boroughs. And this is where we were last year. This is where we are today, 2017, in 35 high-poverty schools and centers, including our first program in Staten Island. So we are now officially in all 5 boroughs. And that's where we will be in 2018. At the same time that we were doing this work, a lot's been going on in New York City, especially since 2005 when we started our second trial. And so this is just for me to say that Pre-K for All is an incredibly smart, I think, investment by the mayor, by the city, and by the state to give all children in New York City an opportunity to engage in, does that say 1? Okay, a full day pre-K. At the same time, 2 years ago, there was another mayoral initiative that people outside of New York may not have heard of, which is called Thrive New York City. And that's a deeper investment in the mental health of all New Yorkers. And that was embedded in the pre-K programming in part, and we developed with our partners in the Department of Education a 3-tiered model for spreading Parent Corps and Parent Corps evidence-based practices. And so this is just to say that we are supporting universally efforts in all 1,870 pre-K programs, serving 70,000 children annually. We are, and in addition, we are spreading evidence-based practices through pretty intensive professional learning in 350 programs. And then we continue to deliver Parent Corps in a subset of those programs, 55. And so what that has enabled us to do is develop not only a 3-year scale plan, but a 3-year evaluation plan. And so in partnership with the Department of Education, we've designed and launched this year 3 randomized controlled trials that are really hybrid implementation and effectiveness trials, so we can rigorously evaluate the Scale-Up initiative and really think about the added value of each of these tiers. And so just to conclude with opportunities, challenges, and future directions, I think the opportunities both in New York City and across the nation are enormous to partner with education providers and leaders to implement health promotion programs. The challenges, as you can imagine, are maybe even more enormous. And to me, the biggest challenge, and I think about this saying that what got you here is not going to get you there, and really moving from the efficacy data and the promise of these interventions to actually implementing at scale, evaluating at scale, improving at scale, and innovating at scale is something that there's really no recipe in how to do this. And so most days it feels to us like we are building the plane and flying it at the same time. And so for future directions, it's my hope that we safely land the plane in New York City and then really do our best in this partnership at describing the lessons learned and how we are doing this work together, which is really all about relationships, partnerships, trust, most days a good sense of humor to move us forward. And so I just wanted to end by thanking our funders for this specific initiative, which include state funding from the Office of Mental Health and city funding from the Department of Education, both from education dollars and mental health dollars, support from the NYU Langone Health, from the Community Service Plan, and then 5 incredible family foundations who have supported this work, and the Institute of Education Sciences. Thank you.